Malignant tumors refer to cells within the body under the influence of various carcinogenic factors, whose genes undergone changes, resulting in the loss of normal growth regulation, which leads to abnormal cell proliferation and the formation of a neoplasm. Malignant tumor not only continue to grow, but also possess the ability to invade and destroy normal tissues and organs, which is often the main cause for mortality. What if cancer is diagnosed? Cancer treatment is a very complex scientific problem. There is no one-size-fits-all approach, nor is it an automatic death sentence. No need to give it up. The World Health Organization emphasizes 3 key points of 1/3. 1/3 of cancers can be prevented by addressing risk factors. 1/3 of cancers can be cured through early detection and treatment. The remaining third can be managed medically to improve quality of life, alleviate suffering, and extend life. Current cancer treatments, including surgery, radiation therapy, chemotherapy, immunotherapy, targeted therapy, and local ablation, typically involve a multidisciplinary approach. Among all treatment modalities for malignant tumors, focused ultrasound ablation stands out as the only method that requires no incisions. A non-invasive therapy, this technique uses external ultrasound waves that can pass through normal tissues to focus on tumor tissues in vivo, raising the temperature of the focal area to 65–100 degrees Celsius instantaneously, resulting in irreversible coagulative necrosis of the tumor. No incision or puncture required, with non-traumatic skin on the surface, and no radiation or chemical damage. During focused ultrasound treatment for tumor, there is real-time monitoring with B-mode ultrasound, ensuring precise targeting and conformal ablation for safe and effective treatment, making it suitable even for those who cannot tolerate traditional surgery, such as for elderly or frail patients. This kind of operation can also be accepted. Focused ultrasound ablation can be used for the treatment of various solid tumors, such as liver tumors and breast cancer. It can also address soft tissue tumors and bone tumors throughout the body. For benign solid tumors, it also has wide clinical applications, such as uterine fibroids and mammary fibroadenoma. In the field of comprehensive cancer treatment, focused ultrasound ablation can play a vital role. 1. Synergistic therapy with radiotherapy. Focused ultrasound ablation produces energy deposition with sublethal effects, increasing the sensitivity of cancer cells to radiation, and enhancing the effectiveness of radiotherapy, thereby controlling tumors and reducing recurrence and metastasis. 2. Synergistic therapy with drug treatment, including chemotherapy drugs, targeted drugs, and immune therapy drugs. Focused ultrasound ablation opens the blood-tumor barrier, increases intratumoral drug concentration, enhancing anti-tumor immunity, and improving the drug sensitivity and resistance of tumors. Synergistic therapy with traditional surgery. Focused ultrasound ablation can reduce intraoperative bleeding during traditional operations, making the boundary between tumor and normal tissue clearer, thus reducing surgical risks and creating conditions for complete resection of the tumor. 4. Oversized tumors. After shrinking it with focused ultrasound ablation, performing a traditional surgery can reducing the extent of resection and minimizing trauma. Cancer is difficult to cure completely. However, patients should maintain an optimistic attitude and actively cooperate with doctor for treatment. This can prolong life to the greatest extent. Many patients with advanced stage cancer, after receiving scientific treatment, can still achieve long-term survival with tumor. Living with a tumor is the common state for patients with advanced cancer, allowing them to survive for an extended period, improve the quality of life, reduce treatment-related harm. Positive mindset and reasonable treatment is the best way to overcome cancer.